A lot of orthodontists decide to use bracket adhesive for attachment material. It totally makes sense based on inventory. It's sitting right there at every chair. Assistants know how to use it, so you don't need to order this extra inventory. It's clear. I mean, everything sounds perfect until what happens is over the course of 6 months or 8 months of treatment, and patients have these attachments on, you will notice the attachments start to flake off. Or, more importantly, attachments start to wear down and you can't even fully tell. Any Invisalign speaker that discusses attachments, and Invisalign will tell you themselves, the surface of the attachment, aka the working surface, that the aligner is pushing on when it's activated, should never be touched when you're cleaning off flash, or during treatment. If there is any damage there, Invisalign will recommend that you repair that. That is all you have to push on. It's much like if a bracket breaks in half. You are going to replace it because you cannot get the proper force distribution on that tooth. Therefore, you cannot use any bracket adhesive on the market today. It is not filled enough to be resistant. Okay? You will get less predictable tooth movement, I guarantee you. So, we have products such as Grandio, okay, which comes in a packable form just like this, and you have what we use is GrandioSO, which is a heavy flow. Some orthodontists decide to use flowable composite if they're doing indirect bonding like we are in our office universally. The beauty of flowable composite, as you all know, is its delivery into the attachment wells. When I design attachments with Invisalign, I want my attachments to be placed in the junction of the incisal and middle thirds of the tooth. And that is just something that I've learned and something that I swear by today, because the aligner is more rigid there, which means it's going to grip the attachment better. Unfortunately, if you put attachments at the junction of the incisal and middle third of the actual tray, the attachment wells, what happens is it's difficult to get any attachment material into those attachment wells or attachment trays when you have to load the tray before you place it in the patient's mouth. So you're going to need some kind of delivery system that's going to be predictable or less clumsy, especially if you have assistants loading them before you cure them. GrandioSO has been the solution for us because it has these beautiful tips, but more importantly, I'm going to show you the exact one that I use, and it is this one. It's these. So it's the same capsule method, but it has the extended tip here. So you can easily place this into any attachment well, on any attachment template, and get a perfect fill without any flash or any mess in the loading. There are different colors to choose from, which is fine and dandy. And so if you're the type of office that wants to choose different colors to match different shades and you're going to shade match, I commend you. Unfortunately, due to the systems in our office and based on the patient response, everyone gets A1 in our office right now. It is just to have inventory. It's to keep things more efficient in our office, and we can move faster with patients that way, and we haven't had a single complaint yet.